When Callie stopped breathing again, her family could do nothing but watch helplessly behind a glass wall as doctors tried for 45 minutes to revive her. Tragically, Callie could not be saved. She was just 5 weeks old. How could this possibly be? It just seemed like a common cough or cold. Hi, my name is Stephanie Knobs, and I'm here to inform you about an epidemic that is currently going on right here in our own backyards. It's called pertussis, also known as whooping cough. It's a human pathogen disease with no known animal or environmental reservoir. That's right, you, and myself are all responsible for spreading this potentially deadly disease to our loved ones. As described from the Center of Disease Control, pertussis is a highly contagious bacterial disease that settles in our respiratory tract. This causes uncontrollable coughing and makes it very difficult to breathe. The bacteria doesn't live outside the body, so in order to come into contact with it, you would need to be in the same room or breathe in the same air as somebody that is infected would. So if they were coughing or sneezing, that's how you could get the potential disease. Now, it takes more than one inhalation of the bacterium in order for you to get it. It actually takes hundreds and thousands for you to actually retain it. Unless, of course, you're susceptible like a newborn would be. Now, let me explain. You're probably thinking a cough? That doesn't sound so bad. Like, what's the big deal? There's actually tiny hairs in our respiratory tract. In this, when we talk about respiratory tract with this, we're talking about nose, mouth, lungs. There's cilia in your nose and lungs that move air. They filter the air that you breathe, so it makes it so you're breathing in clean air. Cilia keep the airways clean of mucus and dirt and allow us to breathe without irritation. Think of it like an escalator in a mall, constantly moving and rotating people up and down. When pertussis attacks the respiratory area, those tiny hairs become paralyzed, so nothing moves. All the congestion, mucus, buildup, it all sits right in your respiratory tract, which is where the intense coughing comes into play. The disease usually starts with cold-like symptoms like sneezing, watery eyes, runny nose, maybe a potential low-grade fever. After about 1 to 2 weeks, the cough and the cold will start to get better, and you'll actually think you're on your way to recovery until the cough gets worse. Very bad at night, and usually have things like coughing spells where you're having difficulty breathing. The cough will become so violent and rapidly occurring over and over and over again until all the air from your lungs is expelled and you have to inhale, causing you to make a deep whooping sound, which is where the whooping cough came from. In addition, teens and adults can experience bruised or cracked ribs, abdominal hernias, broken blood vessels in the skins or whites of their eyes from coughing so hard. Infant complications can be more severe and may include pneumonia, dehydration, stopped breathing, seizures, brain damage, and even death. Sadly, this is what occurred with baby Callie. I do have a video clip for you to hear of what pertussis sounds like. This is a 2-year-old with pertussis. That cycle goes on and on and on. So pertussis has been found to peak every 3 to 5 years when the number of susceptible people in our population increases. The last outbreak besides now was in 2010. Here's a map of the state of California, which shows no reported cases, very, very few in California, but no reported. You can see pretty much statewide, there is a lot of dark purple and red areas, which are higher than average documented cases of pertussis. The recent report from the California Department of Public Health stated that there have been 1,100 new cases of pertussis in California in just the last 2 weeks alone. This brings the total number of cases to 4,558, just as of June 24th, and we're only halfway through the year. This far surpasses the amount that in 2013, which was just a little over 2,000 cases. Children 4 months and younger account for nearly 2/3 of all hospitalizations. And just this year in California as well, there have been 3 additional infant deaths. Now, infants are most at risk of this disease, as I've already told you, mainly because they're too young to be fully immunized. Infants cannot receive their first DTaP vaccine, which is diphtheria, tetanus, and pertussis, until they are at least 6 weeks of age. This makes all of us ticking time bombs for these kids. When I say us, I'm saying moms, dads, grandparents, aunts, uncles, siblings, the nanny, your neighbor that came over to visit your brand new bundle of joy. So how do we combat this? How do we help these kids from getting it? How do we prevent this? Well, there's good news. There are ways of preventing infants from getting this. And that is basically attack it before the infant is ever even born. So that's where we're going to start. We're going to start with moms. Okay, moms, are you ready? It's all about you. This is where it comes from. There's a vaccine out there called Tdap, which is the adult version of DTaP. It's tetanus, diphtheria, and pertussis. The recommendation for UpToDate.com and the American Congress of Obstetrics and Gynecology wrote that all pregnant women should be vaccinated within their 3rd trimester of pregnancy, irregardless if they've received Tdap in the past or time frame. Every pregnancy, 3rd trimester. This time frame will optimize antibody transfer and protect the infant until birth until they're old enough to be vaccinated. It is also equally important and highly recommended that any other adults in contact with the infant should be up to date with their vaccine as well. Now let's dig a little bit deeper. I don't want anyone to be misguided when it comes to the DTaP vaccine. Just because your baby is now 6 weeks old and has received 1 DTaP vaccine does not mean they're fully immunized. An article published by the Mayo Clinic in 2013 stated that children aren't fully immune to whooping cough until they've received at least 3 shots. That's 2 months, 4 months, and 6 months, leaving those 6 months and younger still at great risk to get pertussis. In addition, whooping cough vaccine that you receive as a child does eventually wear off, so they are recommending that you get boosters, one between 10 and 18 years old and another between 19 to 65 and up. Tdap vaccine, actually per the Mayo Clinic as well, also has efficacy of 90% when given correctly and on the correct schedule. Testing is easy. Testing can be done at your local doctor's office. They take a nasopharyngeal swab, they place it to the back of your nose and throat where they collect fluid, and it's sent off to the lab for PCR confirmation. Any patient being tested should be placed on a recommended antibiotic and advised to stay home until the results are back. Results typically take about 3 to 4 days. This ensures the spread of infection does not continue. If he or she are found to be positive for pertussis, they should complete a 5-day course of the recommended antibiotics, as well as any family members living with them. Any close contact with the patient. If you have had close contact with the patient and have symptoms, you are also asked to be quarantined and seen at your doctor's office. Per the CDC, this means any face-to-face contact within 3 feet of a symptomatic patient, direct contact with respiratory, oral, nasal secretions from that patient, or sharing the same confined space in close proximity with the patient for over 1 hour. In conclusion, knowledge is power. The more you know about vaccines and the disease, the more you can help yourself and prevent them. That having been said, you are in control of your healthcare and ultimately make the final choice. I wish you all a very happy, healthy life. Thank you very much for your time.